With that, let's start with your questions. As I say, they can be about anything. And do we have microphones around, or you're just we can yell? Okay. The first hand I saw go up was this young woman right there. Yes. Yes.
My name is Brenda Bouchard. I live in Madbury. I've been a caregiver for my husband for nearly 10 years. He has younger onset Alzheimer's disease. My mother's almost 89, lives with me. She has Alzheimer's disease too. I'm one of 65,000 Alzheimer's caregivers in the state of New Hampshire. I know firsthand the pain of seeing somebody slip away through this disease. I also know firsthand the financial burden this disease carries for families as well as our country. So my question to you is, in your presidential campaign and beyond, what will you do to ensure that this devastating disease and the potential bankruptcy to Medicare and Medicaid will get the attention it needs? Thank you.
Well, first, let me thank you. Let me really thank you for your caregiving and your care. I want you to just think about what she said. 65,000 caregivers right here in one state. And multiply that many, many, many times over. And we have a caregiving crisis. We have so many millions of people who are providing either full-time or part-time care for those they love, for spouses, for children, for their aging parents or other relatives. And we're going to have to come to grips with this, because right now we're not doing enough to support you in the important work you are doing in your home. I want to make 3 points. First, with respect specifically to Alzheimer's, I am 100% committed to increasing the research that goes into Alzheimer's. And one of the real unfortunate setbacks from the cutbacks from the Congress is that so much of the health research done by the National Institutes of Health and other first-rate research institutions has been cut back. I was talking to a scientist the other day who said that when the Congress cut the money for the NIH and others, literally labs were closed, young scientists were laid off, and it stopped progress in a number of very important efforts, including with respect to Alzheimer's. We've got to get back funding our research and science agenda, and in particularly our research into diseases like Alzheimer's, because we're going to be on the brink of making some breakthroughs. Secondly, I think we've got to do more within the government programs, particularly Medicare, to provide more support for caregiving that is given by a relative. Now, people worry that, okay, how do you make the judgment? We can pay for a visiting nurse. We can pay for somebody coming in from the outside. But how do we provide some kind of financial support for the woman taking care of her husband and her mother? I think we're smart enough to figure that out. And I think our failure to do so will actually end up costing more money, because more people will not be able to do what you are doing. They can't afford it. So therefore, they will turn and say, I have to keep working because I also have dependent children at home. I have to keep working because my husband no longer can. And so I can't do any of the caregiving. I've got to go into the formal workplace. Well, then somebody's going to have to come in and help. And that's going to cost money. So why can't we be smart enough to figure out how we support the family caregivers in addition to the non-family caregivers? And I am working very hard to figure out how we do that, because clearly the costs projected into the future are quite substantial. But as a friend of mine who's taking care of her husband said to me not so long ago, she said, if every family caregiver stopped working tomorrow, you'd have to find about $350 billion worth of care to make up the difference. So let's figure out how we do that, and don't discriminate against family caregivers. And we also need to give you more respite care. There has to be a program for respite care, because too many people they do the work, and they do it out of love, devotion, but it's a 24/7 job. And they don't have time to go to the store, to have a cup of tea with a friend, to get their hair fixed. They don't have time to do anything unless there's some respite care in the home or in another facility. And finally, the last thing I would say is I'm looking at an idea that I heard about recently, the Care Corps. Here's what I think we might be able to do in every community. Have a coordinating mechanism so that people who are trained in how they would care for someone who has Alzheimer's or any other ailment could be, on a volunteer basis, willing to come in to your home for a certain period of time. You know, there are a lot of people who are retired. There are a lot of retired nurses and teachers, business people and others who look for volunteer opportunities. And I think if we had a Care Corps where we help to fund just the mechanism, maybe the online request, maybe the telephone line, maybe somebody to make the appointments, we could help supplement what might be done by both the family and professional caregivers. But this is a huge issue, and as you can tell, I've been thinking a lot about it. You know, my late mother lived with us until she passed away, and she was thankfully in good health, but she had some real beginnings of deterioration physically, and so I am well aware of how important this is, and I really want to thank you for raising it. Thank you so much. Well, I'm going to get to as many questions as I can.